Here is what your chiropractic treatment should look like. I'm Dr. Melissa Lockhart. I am a chiropractic physician, and sometimes your chiropractic treatment plan at your chiropractor's office looks like this. 3 visits a week for 12 weeks, then 2 visits a week for another 6 weeks, and then every once a week for 4 to 6 weeks. And this thing just seems to go on forever. You've been there 50 times. Maybe you're feeling better. Great. If you stop going, then all that pain comes back, and what the heck was the point anyway? Here's what your chiropractic treatment plan should look like. Let's start from day 1. When you go in and you meet your chiropractic physician, they take a nice, thorough, long history. They understand your medical history. They understand any imaging you've had, any accidents you've had. They've asked you tons of questions about prior treatments and what your response to those treatments were. Then the exam, okay? This is something that also doesn't necessarily happen as much as it should. A good, long, thorough exam, complete with everything, not just palpating the spine, touching the spine, but also reflex testing, motor strength testing, sensation testing, orthopedics, everything. And then the treatment plan should look like this. Let's take it a few weeks at a time. Let's not plan for you to be here for the next 6 months, because what if you get better faster than that? Let's take it a few weeks at a time. I personally, in my office, never see a patient 3 times a week, with the exception of possibly severely injured patients or patients who have disc herniations. We're talking like they are super acute. They're in a lot of pain. They need regular decompression just to get through the night. Those people are in a little more often. But in general, twice a week for a couple weeks is about what we do. At the end of 2-3 weeks, most of my patients, probably 80%, are feeling a whole lot better. And at that point, we're starting to reduce our care. Oftentimes, your treatment plan should include home exercises and home stretches, or maybe some co-management with a good physical therapist, because I tell you, a lot of the patients I see, a big part of the problem and the reason they're having the symptoms they're having is they have weakness. A lot of people are super deconditioned now. We sit in our cars, we sit at our desks, and we really don't exercise much. So those people get some instruction so they can also help themselves at home. And that is what a typical chiropractic treatment plan, in my opinion, should look like, versus spending 6, 8, 12 months at the chiropractor. And at the end of it all, A, you're broke, and B, you stop going and you feel bad again. That's just really not where it's at. It's really not the way it's supposed to be done. As far as regular visits to the chiropractor, I'm still a fan of people, even when they're feeling good, coming in, but we're talking about just a wellness kind of routine maintenance visit. For some people, it's about every month. For some people, it's a couple times a year. It just depends on their situation. Some of my patients are super chronic. They have all kinds of issues, and they need to be in a little more often in order to maintain how they're feeling. And some people, I don't see that much at all. So that is what a chiropractic treatment plan should look like. And on the topic of patients needing strengthening, probably 8 out of 10 of my patients get at least 1 exercise to do at home. We keep it to no more than 3, because I know most people won't do them if they're taking too long. I won't even do them if they're taking too long. The exercises are super simple and straightforward, but that's a big part of co-management. In my office, we also have 3 massage therapists, because sometimes a little bit of soft tissue help along the way helps people recover faster, helps us reach our goals sooner. It's okay to go to a chiropractic office that doesn't have massage, but if you are one of those people that has a lot of hypertonicity, a lot of tightness in the muscles, it might take a whole lot longer and a whole lot more adjusting for you to get well. And for some of those people, they just really don't get all the way well. And stretching is wonderful. I'm a big believer, but massage tends to accelerate the process really nicely, and it keeps people from needing forever treatment in the office. They actually get better a lot quicker that way. And if you would like to watch an earlier video I made on bad posture and exercises you can do at home that help with pain related to bad posture, watch my video that's linked above.